Okay, so let's talk about the difference between a deep latch versus a shallow latch. If you are breastfeeding, about to deliver soon, make sure you watch this video for some important tips to help your breastfeeding journey start on the right foot. Make sure that you save and like this video and leave us any questions or comments. So a deep latch with breastfeeding should not be painful. You might feel like a little bit of a comfortable discomfort, but you should never feel any pain. It should never make you wince in pain, or you should never feel any pinching sensation. All you really should feel is just a tugging sensation. Again, that's kind of like a comfortable discomfort. Signs of a shallow latch are going to be if you feel any pinching when the baby is sucking, if you see any dimpling of those cheeks, if you hear any clicking sounds. Those are signs that you want to take that baby off and relatch for a deeper latch. The other thing that you'll notice is when your baby comes off the breast, take a look at the nipple. Is the nipple pulled out nice and round, symmetrical, or are you seeing any creasing to the center of that nipple? Or if you're seeing anything that looks like a lipstick shape, where the top portion of that nipple is pulled out more than the bottom portion, or vice versa. If you see any of those signs, again, that is an indication that it probably was a shallow latch, or that there's something going on with that latch. It's important to make sure that you have a deep latch because the baby will be able to get more milk that way. So it will help your baby gain weight because the baby's getting more milk that they're supposed to be getting, and it's also going to help increase your milk supply. If you have a shallow latch, that is going to affect your milk supply. That is also going to affect your baby's weight gain, and it can also cause nipple trauma. Trust me, you don't want nipple trauma happening. Your nipples can get cracked, bleeding, bruised, blistered, and it can make latching really, really uncomfortable. And sometimes all it takes is just one bad latch for that to kind of kickstart all of those issues. Now, if you're in the hospital and you are latching the baby by yourself and you're not sure if it's a deep enough latch, make sure that you're ringing out for either a nurse or a lactation consultant to check that latch for you. There's so much more to breastfeeding than just getting that baby latched onto the nipple. You want to make sure that the baby's latching onto the nipple plus some of that areola as well. If you have noticed any of these signs of a shallow latch with your breastfeeding journey, please make sure that you're seeking out a lactation consultant to help you with this.